Guys, and welcome to Work It Out Wednesday. So today, we had a question that states a 65-year-old African American male presents to the office for follow-up. His blood pressure is 148/98. He has a history of hyperlipidemia and type 2 diabetes. They have been following his BP over the past couple of office visits, and it continues to be uncontrolled. How should the nurse practitioner treat? So remember, we always look at the stem of the question first. So how should the nurse practitioner treat based on these findings? So first, I want y'all to remember that we're no longer doing JNC8 on any of the tests at this point. We're going by the ACC and the AHA guidelines. So this patient, we don't need to worry about the age, but we see that their blood pressure is 148/98. Now, you remember that 140/90 based on ACC and AHA guidelines is the range that we start to initiate therapy for people who do not have any comorbidities. And then those who have a blood pressure of 130/80, we start to initiate if they do have comorbidities. So here they do, right? Because they have hyperlipidemia and type 2 diabetes. So we need to initiate some type of therapy, correct? Now we think about first-line therapies. So many of y'all went for the bait, which is A, to initiate HCTZ because it's a thiazide, because thiazides are first-line therapy, right? But you have to remember, for our diabetic patients or people with chronic kidney disease, we do ACEs or ARBs to protect their kidneys. So you want to look for that ACE inhibitor. So that's why the answer is C, to initiate lisinopril, which is an ACE inhibitor. Remembering that ACEs end in pril, and you want to treat with that. So we took out A because it's a thiazide, but they're diabetic. We don't want to give a beta blocker, and D is a calcium channel blocker, okay? So the answer is C. I hope you found this helpful, and follow me back here next Wednesday for another Work It Out Wednesday question. Share and have your friends to come along and join so that we can go over these questions each week. Again, I hope you found it helpful, and I'll meet y'all back here next week. Talk to y'all soon.